Yeah, you're on. You're on. There you go. Yeah, it'll work. Then
We're in order, Madam Secretary. Where are you?
we'll take it.
Take the roll.
Senator Bailey. Representative Bricken. Senator Campbell.
Present.
Representative Darby.
Here.
Representative Dixie. Chairman Gardenhire.
Present.
Representative Hicks of Rogersville. Representative Hicks of Gray. Chairman Howell.
Here.
Representative Littleton.
Here.
Senator Rose.
Here.
Representative Shaw.
Here.
Senator Sutherland.
Here.
Senator Watson. Senator Yeager. Senator Yarborough. You have a quorum, Mr. Chairman.
Thank you. Thank you. We're going to go over the statewide contracts. Do I have a motion to accept the statewide contracts? We have a motion and a second. All in favor, say aye. Aye. Opposed, nays. Ayes have it. Thank you. Going to the agency term contracts. Do I hear a motion to accept those?
Motion.
We have a motion and a second. Any discussion? I see no discussions. All in favor, say aye.
Aye.
Opposed, nays. Ayes have it. I will turn the gavel over to Chairman Howell.
Thank you, Chairman Gardenhire. We have a number of items on our agenda, 41 to be exact, but before we get started, we'll do a little house cleaning here. Item number 4 is off notice. Item number 6, Commerce and Insurance, is rolled until the June meeting, and item number 9 has been taken off notice without objection. All right, we'll begin with number 1 on the calendar, Human Services. If you come forward, and we'll ask Finance Administration to be on deck, if you don't mind. And we are with Human Services Alliance Enterprises contract. Please tell us about that.
Good morning, Chairman Howell, Chairman Gardenhire, and committee members. I'm Paige Foster, DHS Legislative Liaison, joined today by Callan Baggett and our attorney, Mike Leitzke. Item number 1 is an amendment to our existing contract with Alliance Enterprises that provides a web-based case management system for our vocational rehabilitation clients. This amendment extends the contract by 6 months. I'm so sorry. Increases the maximum liability to cover the extension, and then has a couple of language changes. Do we have any questions?
We have a motion. Have a second. Any questions? We're ready to vote. All in favor of this contract, please say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Moving on to item number 2 with Harris Computer Corporation. And that is with Finance and Administration. You're on deck. We'll ask TBI to come forward, if you would, please.
Thank you, Chairman, members
Thank
of this
you.
committee. I'm Chris Benson. I serve as the Deputy Director of Enterprise Governance and Administration for Strategic Technology Solutions. To my right is Malind Kumble, an Executive IT Director for STS in our Edison division. We're here today to request your approval for a 3-year contract extension with 2 annual renewal options and a maximum liability increase for our contract with Harris Computer Corporation for the continued use of Inova cashiering software. Inova software is used by the state for recording receipts of cash, checks, credit cards, and debit cards in Edison. Continuing this contract is vital for continuing Edison financial operations. STS is currently developing an RFP to replace our Edison ERP system. When the new ERP system is fully implemented and in production, the Inova software application will no longer be needed, and this contract will be canceled for convenience.
I have a motion and a second. Any questions? Seeing none, we're ready to vote. All in favor of the contract, please say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Thank you so much. Moving on to item number 3, TBI, Tailored Solutions Corporation. Good morning.
Good morning. I'm Rachel Russell. I'm Deputy Counsel of Operations with the TBI. With me today is Nancy Myers, our Deputy General Counsel, who helped in the preparation of this contract. TBI is seeking to enter into a sole source contract for the maintenance and support of our FlexCheck software. The FlexCheck system handles and automates numerous processes within the Bureau. Some of those items specifically are going to be our background check system. That is going to be for employment. So think those that work with the vulnerable, with elderly individuals. In addition to that, the system also handles the background check processes for firearm purchasing, as well as inputting certain dispositions and expungements into Tennessee criminal history records. Tailored Solutions is the company that owns this particular software. Therefore, that is why they are the only entity that can currently provide the needed maintenance and support. This proposed contract is for 3 years, and the maximum liability is right under $960,000. With that, we are ready for any questions the committee may have.
You've heard the explanation. While we're waiting on that, we'll ask TDEC to come and be on deck, please. You've heard the explanation. Have a motion. Representative Shaw, have a second. Any questions? Seeing none, we're ready to vote. All in favor of the contract, please say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Thank you for being here this morning. Moving on to item number 5, Environment and Conservation, Charter Communications. Good morning. You're recognized. We'll ask corrections to please come and be on deck. You're recognized. Sorry.
Good morning, FRC Chairman and committee members. My name is Lindsay Oliveras, Senior Sourcing Advisor for the Department of Environment and Conservation. With me, I have Liz Campbell, Strategic Initiatives Manager, and Ron Nutt, STS IT Supervisor supporting state parks. We are here today to request approval of an amendment to our existing contract with Charter Communications Operating LLC for internet installation and service at Tennessee state parks. The amendment increases the contract's maximum liability to $1,367,794. This increase supports the installation and expansion of fiber internet infrastructure across Tennessee state parks, including additional parks and new service locations within existing parks. All parks to be covered by this agreement are already served and to some degree by this vendor, which in some cases is the sole provider of the services in the area or has existing infrastructure to reduce installation costs. Consolidating under one contract will achieve cost savings and administrative efficiency. Overall, this amendment ensures consistent, high-quality internet service across multiple parks, supporting operations, safety, and visitor experience while leveraging existing infrastructure and cost efficiencies through this provider. Thank you.
You've heard the explanation. I have a motion. I have a second. Any questions? Seeing none, we're ready to vote. All in favor, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Thank you so much. Corrections is here now, and we'll ask Disability and Aging if they would come forward. And corrections, you're recognized. Good morning.
Yes, sir. Good morning, Chairman Howell, Chairman Gardenhire Committee, Ashley Fuquay, Legislative Director for the Tennessee Department of Correction. The first item we have for you today is our current contract with Jules Enterprise Group doing business as a Nuco RX. Today, the department is requesting your approval to exercise the renewal option for our current contract. This amendment extends the contract an additional year to June 30th, 2027, increases the max liability of the current contract by $100,000, making the total $400,000.
I hear a motion. I hear a second. Any questions? Seeing none, we're ready to vote. All in favor of the contract, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Thank you so much. And you have one more, don't you?
Yes, sir.
Number 7. Go ahead. You're
Okay.
recognized.
Thank you. Good morning again. Ashley Fuquay, Legislative Director for the Tennessee Department of Correction. Our last item today for the committee's consideration is our current contract with Centurion of Tennessee LLC. The department is respectfully requesting your approval to exercise the first renewal option on our current contract. This again will extend the current contract an additional year to June 30th, 2027. This amendment does not raise the max liability. Centurion provides comprehensive behavioral health care services for inmates across TDOC facilities. So this could be a myriad of different things: psychiatric care, psychological assessments, crisis response, substance abuse treatment, other cognitive behavioral programming. So just respectfully request your approval.
We have a motion and a second. Any questions? Hearing none. We're ready to vote. All in favor of the contract, say aye. Aye. All opposed, nay. Ayes have it. The contract is approved. Thank you, Ms. Fuqua.
Thank you, committee.
Appreciate it. Moving on to item number 10, disability and aging, and we'll ask education to be on deck, please. And we will recognize disability and aging for technology first shift. You're recognized.
Thank you, Mr. Chairman. Hello, my name is Trey Jones. I'm the Legislative Director for the Department of Disability and Aging. Joining me today is Dane Mortensen, our Legislative Assistant Director, and Jordan Allen, our Deputy Commissioner of Program Operations. Today, the Department of Disability and Aging is requesting a 6-month extension for our contract with Technology First Shift. The SHIFT program creates valuable curriculum and training around DDA's Technology First and Employment First initiatives. This training leads to direct support for individuals with disabilities, an aging job coach and job development training. This contract includes $186,000 addition to the maximum liability to cover expenditures through June 30th of 2027.
You've heard the explanation. I have a motion. I have a second. Any questions? Hearing none. All in favor, say aye. Aye. All opposed, nay. Ayes have it. That contract is approved. Let's move on to item number 11. You're recognized.
Thank you, Mr. Chairman. The Department of Disability and Aging is requesting a 5-month extension to our current agreement with Terrain Farm Company. This contract is for the provision of pharmacy services across the state, and these services are critical to the operation that we do in the department to provide medication, emergency prescriptions, record services, and dispensing services to the population that we serve. There's no additional funding required, and this amendment would extend the contract to December 31st, 2026.
You've heard the explanation. We have a motion and second. Any questions? Hearing none, we're ready to vote. All in favor, say aye. Aye. All opposed, nay. Ayes have it. The contract is approved. Thank you so much.
Thank you, Mr. Chairman.
Education, you're on deck. We'll ask health to please come forward and be ready. Item number 12, education EMS LINQ. I guess that's Link, isn't it?
Yes, sir. Thank you, Chairman.
You're recognized.
Thank you, Chairman. My name is Anna Hall, and I'm the Legislative Liaison for the Department of Education. With me is Ms. Marianne Dursky, Chief Financial Officer, and Ms. Debbie Thompson, Assistant Commissioner of Federal Programs and Oversight. Number 12 on your agenda is an amendment to the department's contract with EMS Link LLC for the provision of ePlan, the department's grant management system. This amendment will extend the contract term by 1 year through June 2027, increase the maximum liability by $428,000, and modify the scope to add additional planning services. ePlan is a critical tool for the management and distribution of over $7.5 billion in federal, state, and interagency education grants, including nearly all the state and federal dollars received by local school districts. The department is in the process of competitively procuring a new contract for the grants management and planning system, with the RFP concluding in July. This extension and additional scope will allow the department to facilitate.
We have a
seamless
motion
transition.
on this contract. Waiting on a second. Okay, we have any questions? Senator Yarborough.
Thank you, Mr. Chairman. So this original contract was awarded in July 2019 and with a 3-year term and 2 one-year extensions, which got us through June 2024. Then we've done amendments to get us to 25, now 26, now 27. Help me understand how we're in that situation and why we're this far down the road before doing an RFP.
You're recognized.
Thank you, Senator Yarborough. Yes, the pandemic was a little delay there for a while, and we did not want instability for the districts. They're really used to this platform. This is how they get all of their money. So that consistency is important, and we're using this additional year to support the transition. We do have the RFP out right now. We've got responses, and we will be transitioning to a new contract.
Follow up? Any other questions? Seeing none, we're ready to vote. All in favor of the contract, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Item number 13, education, you're recognized.
Thank you, Chairman. I am Anna Hall, Legislative Liaison for the Department of Education. I am now joined by Ms. Christy Brown, our Chief Academic Officer for the department. Number 13 on your agenda is an amendment to the department's contract with NCS Pearson for the provision of the Tennessee Universal Reading Screener. This amendment would extend the contract for 15 months through September 2027, increase the max liability by $2 million, and make a minor scope adjustment. The Tennessee Literacy Success Act requires the department to procure and provide districts free of charge a universal reading screener for administration to students in grades kindergarten through third grade 3 times per year. The department is currently conducting an RFP for future procurement of the Tennessee Universal Reading Screener, but any change cannot occur during the school year. This amendment will provide uninterrupted use of the Tennessee Universal Reading Screener for districts and students through the 26-27 school year and the 2027 summer programming, including third grade promotion. We are happy to answer any questions.
You've heard the explanation.
Motion.
Have a motion? Have a second? And we have questions. Senator Yarborough.
Well, largely the same question. So this one, I also had roughly a 3-year run with 2 1-year extensions. And like we didn't conduct the, procurement in order to meet that timeline, but we're going beyond, we're doing a non-contractual extension. And I guess, that limitation is actually in statute, I believe. It's not something we're just supposed to waive all the time. So help me understand.
You're recognized.
Thank you, Senator Yarborough. Appreciate that. We had some unforeseen delays with the RFP in this instance, and the reason for the extension, again, similar reasons, not to disrupt the operations of districts and students, and just appreciate your bearing with us.
Follow up? Any other questions? Seeing none, we're ready to vote. All in favor of this contract, please say aye. Aye. All opposed, nay. Ayes have it. Thank you for that. Before we move on, I'd like to recognize Representative Paul Sherrill came in just a moment ago. He's with us this morning visiting. And did you have some visitors with you, Representative?
Mr. Chairman,
Yes.
Senator Bailey right here
Oh,
to your left.
I was looking around, Senator Bailey.
Thank you. Yes, so Representative Sherrill and I, if I may have a personal privilege,
Please.
Mr. Chairman. So I would like to ask the White County Lady Warriors basketball team to please stand and be recognized this morning.
Oh, wow.
They were TSSAA Division I Class 3A state runner-up. This was the first time that they'd made it back to the state championship since 1997. So we missed the opportunity to recognize them on the Senate and House floor during regular session. So we asked them to come down today and be our guest. Coach Dodgen is with them today, as well as Mr. Wilson, who is a former classmate of mine many years ago. And so, and then also we have our trainer with them today, and I'm sorry, Bryn. So welcome to all of you, and Lady Warriors, thank you for being here today. And we'll take you on a little tour just after the committee here. Thank you.
Congratulations. Thank you. Thank you, Senator. Sorry for that interruption. We'll get back to contract number 14. Oh, you're recognized.
Thank you, Mr. Chairman. If I could just put a stamp on that. Coach Dodge in there, my two had a little bit of success with ball, and I owe a lot to him, and it's evident what he's done with the girls back home. So just from West Tennessee, we appreciate you. Thank you.
Very good. Thank you so much. Good to have you with us. Back to the contract list, item number 14, education, worldwide travel. You're recognized.
Thank you, Chairman. I'm Anna Hall, the Legislative Liaison at the Department of Education. My final guest is Dr. Josh Mason, Assistant Commissioner of the State Special Schools. Number 14 on your agenda is an amendment to the department's contract with Worldwide Travel Staffing Limited for the provision of occupational and physical therapy services for the Tennessee School for the Deaf. The amendment would increase this.
Have a motion? Second. Any questions? Seeing none, we're ready to vote. All in favor of this contract, please say aye. Aye. All opposed, nay. Ayes have it. You are approved. Thank you so much. Moving on to item number 15, health is on deck, and then we will ask Children's Services to be ready. Thank you. Let's move on to item number 15, Department of Health with Andy Corporation. You're recognized.
Thank you, Mr. Chairman. Mike Critchfield, Legislative Liaison for the Department of Health. We're respectfully requesting approval to establish a sole source multi-year contract with Andy Corporation for maintenance, support, and purchase of consumables for the Andy Rapid DNA System. Andy Corporation is the original manufacturer of equipment owned by the state. No other vendors are authorized or capable of servicing the equipment or supplying compatible materials.
Have a motion? Second? Questions? Senator Yarbrough?
Thank you, and I understand why that it obviously makes sense that this company's products or the consumables are the only ones that work with its product. I guess why wasn't that part of the original RFP? Right? I mean, if by choosing one system, we're kind of locked into re-upping its supplies and maintenance as well, why wouldn't we be upfront about that in the RFP process?
Thank you for the question, Senator Yarbrough. I think the reason for that is you can't predict the number of materials you'll need in the future. So at the point in time we purchase the equipment, we don't know how many materials we're going to need in the future. So we can't predict that cost accurately. So just as we move forward, we already own the equipment. We're just purchasing compatible materials.
And I guess my question is really was it an inevitability that once we enter into this contract, that we're going to enter into a second sole source contract?
You recognize.
I'll defer to Tara with our procurement office.
Hi there. So Tara Rourke, the Director of Procurement for the Department of Health. So with this, and we've got Dr. Adele Lewis, and she is our Chief Medical Examiner, and she may be able to speak a little bit to the nuances of the Andy system itself. But as far as we've kind of gone back, we needed a system that would work. I believe Andy was the leading edge company for DNA identification, which is essentially what this service is used for. So we've been sole source with them. They've been technically under the threshold. This is the first year that we decided to combine the chips that are required to use with the machine as well as the service and maintenance, because it kind of does come as a cohesive package, which kind of exceeded this threshold to where it's appearing before you today.
Follow up? Any other questions? Hearing none, we are ready to vote. All in favor, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Moving on to item number 16, Natus Sensory. Is that the way you pronounce that? You're recognized.
Yes, sir. Thank you, Mr. Chairman. Again, Mike Critchfield, Legislative Liaison with the Department of Health. The Department of Health requests approval to establish a sole source contract with Natus Sensory for the continued support, maintenance, and upgrades of the Neometrics Laboratory Information Management System and Newborn Screening Database. The Neometrics system is the core platform used by the state's newborn screening program to process, track, and report laboratory results for all infants born in Tennessee. It also supports various other related services and ensures compliance with rules and enabling timely intervention for infants with serious conditions. The contract has a maximum liability of $760,250 and is funded primarily through current services revenue for newborn screening. 5% of the funding comes from federal funds, and the remaining 4% is covered using state funds. Natus Sensory is the sole manufacturer of this proprietary system.
I have a motion. I have a second. Any questions for this contract? Hearing none, we're ready to vote. All in favor, say aye. Aye. All opposed, nay. Ayes have it. That contract is approved. Moving on to item 16, Oxbow Data Management. You're recognized.
Thank you, Mr. Chairman. Mike Critchfield, Legislative Liaison with the Department of Health. The Department of Health is requesting approval to amend our existing contract with Oxbow Data Management Systems to increase funding and expand services to include the Tennessee Lung and Colorectal Screening Program while continuing support.
Have a motion. Have a second. Any questions? We're ready to vote. All in favor of this contract, please say aye. Aye. All opposed, nay. Ayes have it. That contract is approved. Moving on to item 18, Prana Diabetes, Inc. You're recognized.
Thank you, Mr. Chairman. Mike Critchfield, Legislative Liaison with the Department of Health. The Department of Health is requesting approval to amend our existing contract with Planet Diabetes, DBA Habit New. This amendment will extend the contract term by 1 year and will expand the scope of services for the state's diabetes prevention program and diabetes self-management education and support initiatives to support more providers. The scope update adds enhanced program reporting requirements, including monthly activity reports and mid-year and annual progress reports. It additionally adds annual work planning to strengthen program oversight, evaluation, and accountability. These updates will ensure the department has reliable data to monitor the program's performance and outcomes. With the contract term extension and in addition to the scope, the maximum liability of the contract will be $490,875. This contract is 100% federally funded. We're happy to take any questions.
We have a motion. We have a second. Any questions for the sponsor? Seeing none, we're ready to vote. All in favor, say aye. Aye. All opposed, nay. Ayes have it. That contract is approved. Moving on to item number 19, Public Health Foundation. You're recognized.
Thank you, Mr. Chairman. Mike Critchfield, Legislative Liaison with the Department of Health. The Department of Health respectfully requests approval to exercise the renewal option for year 4 of the agreement with the Public Health Foundation
I have a
regarding.
motion and I have a second. Any questions? Hearing none, we're ready to vote. All in favor of this contract, please say aye. Aye. All opposed, nay. Ayes have it. That contract is approved. Moving on to number 20, Tyler Technologies. You're recognized.
Thank you, Mr. Chairman. Again, Mike Critchfield, Legislative Liaison with the Department of Health. The Department of Health Division of Health Licensure and Regulation is requesting approval to establish a sole source contract with Tyler Technologies for the provision of Versa online software application and Versa regulation maintenance support and enhancements. This contract will serve as a 2-year bridge contract to ensure continuity of operations while the department completes a competitive RFP for a new licensing and regulatory system to be awarded in the coming months. Tyler Technologies is the current provider of the department's Versa system, which supports licensing, renewals, and regulatory functions for healthcare professionals across the state. This system enables online applications, renewals, and transaction processing, which increase efficiency and service delivery. The department considered a competitive procurement process for the bridge contract, but this solution would be inefficient, duplicative, and would delay the transition to the new system. This bridge contract ensures continuity of critical licensing operations without disruption and allows the department to complete the competitive process that is already underway. This contract is funded using state dollars and has a total liability of $1,384,155 over the 2-year period. Failure to approve this contract would result in the department having to perform licensure functions manually, which would result in delays, increased administrative burden, and disruption to healthcare professionals' ability to obtain and maintain licensure.
We have a motion. Have a second. Any questions? Senator, you're recognized.
Thank you. Like, I understand not wanting to think about do the bridge separately, but like, we knew this contract was expiring. I guess why were we not on path to have a new vendor lined up before the expiration of this contract?
You're recognized.
Thank you for the question, Senator. I'll defer to Jennifer Putnam, who's our Assistant Commissioner over Lars.
Thank you. Thank you, Senator Yarborough. I appreciate the question. So we were in process of drafting the RFP and working with a third vendor in drafting that RFP to facilitate the RFP and expedite that process. Unfortunately, that timeline went over with that particular vendor that then put us in this situation that would then make it a burden on the department to have to do these manually. And that is why we were not able to execute that in the timeline that you suggested.
Follow up? Any other questions? Seeing none, we're ready to vote. All in favor of this contract, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Thank you, Mr. Critchfield. Children's Services and members without objection, item number 21, 22, 23, 24, 25, and 26, we will bundle together because those contracts are identical with the exception of a few numbers, I believe, and the sponsor of the contract will give us a total at the end, if that's okay. So with that, Ms. O'Donnell, you're recognized.
Good afternoon, members of the Fiscal Review Committee, Chairman Gardenhire and Chairman Howell. Thank you for having us today. Item 21 through 26, the following contracts are amendments to the Youth Villages Case Management Services. These contracts were awarded through a competitive request for proposal services and are currently effective through July 31st of 2026. We are requesting amendments to extend the term to June 30, 2027, and increase the maximum liability for a total of $11,621,748 for a combined new total maximum liability of $39,449,509. These contracts provide identical case management services across various DCS regions and support the department's ability to meet required caseload ratios within the case management series.
I have a motion. Did I hear a second? I have a second. Any questions on these contracts? Hearing none, we're ready to vote. All in favor of this bundle of contracts, please say aye. Aye. All opposed, nay. Ayes have it. Those contracts are approved. We will now move on to item number 27, Chapin Hall Center. You're recognized.
Thank you. Hayes O'Donnell, Legislative Assistant Director with Department of Children's Services. To my right, we have Bo, Executive Director of Contracts, Grants, and Everything Procurement. And to my left, we have Anthony Neese, Executive Director over Federal Programs. Item number 27 is the contract for Chapin Hall Center for Children. This contract is a 3-year sole source contract with Chapin Hall Center for Children with a requested maximum liability of $1,800,000 through the fiscal year of 2029. Chapin Hall has served as a key external partner to the department for more than 15 years, offering performance-based consultation, technical assistance, and advanced data analysis across multiple child welfare systems nationwide. Key services that this contract will be providing through Chapin Hall Services will focus on performance-based contracting that provides consultation and data services to set baselines, benchmarks, and evaluate private provider performances. We will also have contract regional workbooks to develop biannual reports on child welfare outcomes across the Tennessee regions and compare them to other states. We will have a predictive analytics provided to us to support DCS with model development training and predictive analytics to provide improved child welfare outcomes. And finally, the Tennessee's Technical Bulletin number 14, which is a design predictive framework to forecast demand, set goals, and align analytics with federal child welfare performance measures. We are open to take any questions, and we request your support.
Senator, you're recognized.
Thank you, Mr. Chair. So this was procured under Brian A. And I just want to know what changed after Brian A. was phased out with our relationship with this particular vendor.
You're recognized.
Thank you. Yes, Senator, our original relationship was established with Chapin Hall Center for Children during the Brian A. lawsuit, and we have maintained a relationship with them to help monitor and help provide comparisons. And would you like to speak to the differences? Okay. And I will pass this on to Executive Director Tony Neese to speak to the differences between the original contract and the current one.
Good morning. Tony Neese. I'm the Executive Director for Federal Programs with DCS. Originally, Chapin Hall was providing data around Brian A. As we got out of that lawsuit, they continue to provide data for us, data analytics around federal reporting. A lot of the federal reporting we do at the Department of Children's Services to draw down our federal funds is required around metrics that they are able to pull. Chapin Hall also does this for a lot of other states. So they have a database, if you will, of other states' data so they can do comparables with our state against other states so we know how we're performing. As we move forward with changes going on in the federal government, Technical Bulletin 14, which is a new federal regulation, is going to require us to do monthly data reporting to the federal government as opposed to twice a year as we were doing. Chapin Hall will be picking up a lot of that and help us with those pieces. Also, Technical Bulletin 14 is part of the A Home for Every Child, which is a new federal initiative. We are no longer going to be reporting data as we did through the federal CFSR process, Child and Family Service Review. So they will be helping us move certain metrics around. Home for Every Child is the federal regulation. They want us to have one foster home for every one child in care. So they'll be doing a lot of work with that. And on the predictive analysis, we're now federally encouraged to use predictive analysis. So they will be helping us with predictive analysis, our Office of Data Governance and Analytics.
Follow up? Any other questions? We need a motion and a second. I have a motion and I have a second. Any other questions? Hearing none, we're ready to vote on this contract. All in favor, please say aye. Aye. All opposed, nay. Ayes have it. That contract is approved. Item number 28, various delegated authority. You're recognized, Ms. O'Donnell.
Thank you, Chairman. Once again, Hayes O'Donnell, Assistant Legislative Director of Department of Children's Services. To my right, we have Mr. Bo Lewis, who's our Executive Director of Contracts, Grants, and Procurement. And to my left, we have Frank Mix, our Executive Director over the DCS Network Development and Provider Relationships. Item number 28, Delegated Authority for Custodial Out-of-Home Foster Care and Residential Services, is a contract amendment to the Residential Delegated Authority Services. This contract is currently effective through July 31st of 2026. We are requesting approval to extend the term and increase the maximum liability by $406,983,400.
Have a motion? I have a second. Any questions, Senator Yarbrough?
Thank you. So I think this contract was originally a 5-year contract, and I mean, I'm not sure exactly how it's structured, but so it's now a year longer, and it's gone from like 1.6 billion to 2.3 or 2.3 billion. So help me understand just like how the growth of the contracts happen and whether you plan on like, are we going to be back next year for another extension of the same contract? Do you envision changing this contract or having a different competitive process?
You're recognized.
Thank you, Senator. That's a great question. I will kind of go backwards in answering those questions for you. So yes, we are extending this once out of the 5 original terms. This is planning to be the only extension that we are going to be having towards that. In the past year or so, we have been working with KPMG consultants to analyze what is the best placement structure for the children in the state of Tennessee and how we can be the most productive, both in providing appropriate placements and being fiscally responsible to the state and our taxpayers. And so we have worked with them and external partners. The external partners did go a little bit longer than we had anticipated. We were originally not planning to be before you for this 1-year extension. Due to that time frame, it has pushed out. We are getting final recommendations back this Thursday, actually tomorrow. And from there, we will begin officially restructuring our placements and residentials, where we will be bringing a brand new contract. Does that help clarify that time frame?
Follow up, Senator? Any other questions? Hearing none, we're ready to vote on this contract. All in favor, please say aye. Aye. All opposed, nay. Ayes have it. The contract is approved. Thank you for being with us this morning. Moving on to TennCare and Mr. Zane Seals and the members without objection, 29, 30, 31, and 32 with TennCare are identical contracts with maybe the numbers are a little different for each one, but Mr. Seals will give us a total at the end if we would take those 4 contracts together. Thank you.
Good morning, members of the committee. My name is Zane Sills, and I have the privilege of serving as the Chief Financial Officer for the Division of TennCare. Our first 4 contracts are competitively procured managed care contracts with Blue Care, United Healthcare, WellPoint, and Blue Care PIHP or TennCare Select. These are the contract amendments that we bring before you twice a year. This is the mid-year part of the cycle, so there's no extension request. There's no maximum liability request. There's just...
We have a motion on these 4 contracts. Did I hear a second? I got a second. Very good. Any questions? Hearing none, we're ready to vote on this bundle of contracts. All in favor say aye. Aye. All opposed, nay. Ayes have it. Contracts are approved. Moving down to 33. Mr. Seals, you're recognized.
Next contract request is a competitively procured contract with Renaissance Life and Health Insurance Company. In this amendment, we're requesting to increase the maximum liability to account for the Rural Health Transformation federal grant funding. Renaissance serves as our dental benefits manager, or DBM. Part of the Rural Health Transformation Program award for Tennessee includes funding for a patient-centered dental home program in Tennessee. This is modeled after our successful investments into a similar concept for primary care on the medical side. The only changes to this contract are adding in this new funding from the Federal Rural Health Transformation Program. That is a requested increase in maximum liability of $23.3 million, all federal, no state.
You've heard the explanation. Have a motion? Have a second? Any questions? Senator Rose.
Thank you, Mr. Chairman. And Mr. Seals, thank you again for what you do. I assume that since we're doing this, this will not be subject, should not be subject to the clawback that we may experience with some other offerings.
You're right.
Is that correct?
Great question. So the federal money, as I understand it, in the Rural Health Transformation Program is use it or lose it. So if we spend it on the purposes that are authorized in the application, we don't have to worry about it being clawed back. If we don't spend, like we've got 23 million here, if we spend 22.5 million, the rest just reverts to the federal government.
Thank you.
Any other questions? Hearing none, we're ready to vote on this contract. All in favor, please say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Number 34, Mr. Seals, you're recognized.
The next request is for a competitively procured contract with Aunt Bertha, or we call them Find Help. In this request, we're seeking to extend the term of the contract, increase the maximum liability, and update the language to account for federal rural health transformation funding. They operate our closed loop referral system platform. What we're doing in this contract is really, really outside the usual of what we'd normally do. So I'm going to try and briefly explain and then address in more detail if any members have concerns or questions. This is started out as a normal competitively bid 3+2 contract. Instead of requesting to exercise just the first option year, what we're requesting to do is exercise both option years and add 3 extension years. The reason for this is driven by the Rural Health Transformation Program in HR 1, or the Big Beautiful Bill, which creates 5 years of funding. So we were the first agency to competitively procure a closed loop referral system. After we did that, some of our sister agencies in the health space started getting interested in getting their own closed loop referral systems. And then when the Rural Health Transformation Program dollars came along, that provided an opportunity for those agencies to move forward. But we're about 3 years ahead of them because we had already done this and already had funding from the legislature in the budget. So they're pursuing their own contracts with this agency instead of pursuing a bunch of different closed loop referral systems that are discordant and don't talk to each other and don't work well together. So they're going to be bringing forward a contract all with this same vendor. Because of the tight timelines with the closed loop referral system, the Rural Health Transformation funding, where you lose it or use it or lose it, those agencies, I think, are pursuing a sole source because there's no time to go through a normal procurement process. All of us agencies have had conversations with the Central Procurement Office, with the comptroller. We all agree the long-term vision needs to be all agencies getting on one single statewide competitive contract. But importantly, the Rural Health Transformation timelines prevent that from being a realistic immediate option. So right now we have the situation where our contract is essentially 3 years ahead of everybody else's and will end 3 years sooner. So we're bringing this request to try and get on the same contract cycle as everybody else who's bringing a 5-year contract. So I understand this sort of extension is way out of the normal. We do think there's good reasons for it. We think this is.
I have a motion and a second. We have questions. Chairman Hicks.
Thank you. So, Mr. Seals, just remind me again, so is this system right now a one-stop shop for those that are in the TennCare program and outside?
Right now, the only system that exists is our system, which is the TennCare system. The other agencies don't have one. We do have a connection point for Department of Health that they're using on a limited basis, but Department of Health and some of the other sister agencies are looking to exercise a similar concept. But right now, what exists as of today is our system for Medicaid only.
So what's the timing of this? Because I really struggle why this hadn't been why this hadn't been bidded out.
So
So
we
go ahead.
thank you for the question. We did bid ours out. Our contract started on December the 1st of 2023. That was a competitive RFP. And so ours is competitive. The other agencies are interested in getting a similar tool. They don't want to wind up with a situation where there's 4 different agencies working on 4 different platforms. They don't talk together. They don't communicate. They don't work well together. So the idea is all agencies should be on a similar platform. The best way to do that in the future is going to be a single statewide contract procurement. That's not, from a timeline perspective, that's not a realistic option because of the really, really tight timelines on the federal rural health transformation program. So they're going to be bringing forward, I believe, sole source contract to this committee pretty soon, and it'll be offset 3 years. It's a 5-year contract, just like ours is 5 years, but now we're offset 3 years. And so that's what we're trying to do is get synced up with that contract timeline, because the long-term vision for the state really does need to be a single statewide contract for all agencies.
That I totally agree with. I just wish that this would, a program that of this magnitude with what we're going to be doing, what the expectation, I wish that had been bidded out. I will say that. I know you say timing and all that stuff, but sometimes if we slow down, we'll speed up a little bit. And so I'm really, I don't like it. I understand it, but I still don't like not bidding out for those other departments. I'll stop there.
Thank you, Chairman. Senator Yeager, you recognize.
Thank you, Mr. Chairman. I do have a couple of questions, Mr. Chairman. The first one with reference to, I understand that the system allows TennCare to make referrals after the assessments of non-medical needs of its members, but do we have a report that shows whether the referrals are being taken up and any other measurables show that it's improving patients' lives, just not outputs? Since it's good to know the number of referrals, but to what results?
You're recognized.
Thanks for your question. So this contract we're in year 3. The first year was building the system, and then last year we were really starting it. So this kind of contract and this kind of system, which is brand new to the state, does require some ramp up. So, excuse me, as an example, we've done over 20,000 referrals since go live. In the first quarter of 2026, fiscal year 2026, we averaged 50 referrals a day. In the second quarter, that jumped up to 77.6 referrals per day. So we expect that number to keep climbing. We've done over 60,000 assessments since go live. So it is growing. The intent of this program is to put people when providers are treating TennCare patients, to identify risk factors that could be negatively contributing to their health. So the 2 classic examples that I like to give on this are if you have a child with asthma that keeps going to the emergency room or the doctor's office for exacerbations of their asthma condition, if they find out, well, that child lives in a mold-ridden apartment, there's really not a lot a doctor can do. I mean, you can prescribe medicine and stuff, but the conditions that child lives in are going to keep on exacerbating the condition in a way that's negative for that child's health and costs a lot of money. And so if a provider identifies there's a unsafe living situation, they will refer them to community resources. This is not something we pay for, but these would be like nonprofits, religious charities, food banks. We've got a whole network of community resources under here. And so all those referrals are happening, and we are tracking those because it's still so early in the contract. We don't have an evaluation yet. We are intending on running an evaluation once we have a little bit more experience under our belt.
Are we in the second year?
So it's the second year of actual services, the third year of the contract, but the first year was just building the system.
We can't find these measurables in 2 years? I mean, you think it's early?
So we have statistics on the growing number of referrals, but this kind of a system is supposed to bend the cost curve over a number of years. And given that we're just in the second year of the contract, we wouldn't have an evaluation that would talk about the long-term impacts of this yet. We do plan on doing that in the future.
Thank you. I'm gratified to hear that, Mr. Chairman. I appreciate the statistics to demonstrate the increase in the number of referrals, but we're not seeing any statistics on what results. So perhaps in the third year of this program, we'll see those. I would encourage you to do that. I have one other question, Mr. Chairman.
You're recognized.
Okay. The contract, as you said, I believe is connected to funds from the Rural Health Transformation funding. And why are we doing this? Why should the state extend the contract through September 2031 before the rural health transformation money is, the deliverables, the metrics are finalized. You know, I know the Ways and Means Committee has approved the contract, but there's still a lot of work to be done on getting this into the budget, this and in future budget years. So why are we basing the extension of this contract on funding that we haven't entirely received yet?
Thank you
Recognized.
Thank you for your question. So the application that Tennessee submitted to the federal government for this program is a 5-year application. You are right that those funds are only awarded a year at a time. I think our desire in coming forward with this particular request was to try and be transparent about, we think this is the best long-term vision. We'd rather the committee know what we think is the best long-term vision on the front end rather than really we're planning on extensions, but we're not going to tell you about it until it's actually time for the extension. So this was really just a desire on our end to be upfront about this is what we think is going to need to happen to sync all these contracts up.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Campbell.
Thank you. Just not relative, thank you, Mr. Chair, not relative to the contract per se, but I just, while we're talking about this, I just wanted to know if CBOs are part of the intercommunication in the closed loop system.
I'm sorry, I don't know the answer to that question. I can get you an answer though.
Follow up.
I would actually like the answer to that if you don't mind, because I'm just a little bit concerned about HIPAA. You know, when we have a closed loop system and we're you know, doing that communication about you know, vital information, SDOH things, that I think it's important that that we're protecting that, and I'd like to know kind of what HIPAA controls we have in place for that.
Okay.
Thanks.
Senator Yarborough.
Thank you, Mr. Chairman, and I appreciate the explanation of the, you know, what I hope are truly unique circumstances, but just want to echo, you know, I think what Chairman Hicks mentioned here, like, what this contractor is going to end up with a contract that's just wildly different than what they competed for, right? In terms of it will be, you know, we're already kind of quadrupling the max liability based on the starting point. And then we think there's going to be, you know, a sole source contract for other state agencies on top of that. And I understand that like I might not be counting a couple of the extension years, right? But it's still, it's a really different contract. And I just want to, you know, highlight how much, like, we know there are going to be changes. We know there are going to be federal grants, we know that, you know, lots of these things, trying to figure out ways that we plan to avoid situations like this is I think ideal for the competitive state, you know, competitive process of the state.
Any other questions? Members, we need a motion and a second on this contract. We have a motion and a second. Any other questions? Seeing none, we're ready to vote on this contract. All in favor, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Moving on to item number 35. You recognize, Mr. Seals?
Our next contract is a competitively bid contract with Automated Health Systems, or AAH, requesting to extend 1 year and increase the maximum liability to cover that year. In this contract, AHS runs our member call center. So when members need to call in for various issues, this is where they call in. This call center is run out of the Nashville area. This is one of the eligibility procurements that was delayed due to the PHE. The competitive RFP is well underway and is scheduled to be wrapped up and awarded in about 3 weeks. The 1 year extension request is to handle potential vendor transition needs depending on the outcome of that award.
Excuse me, I have a motion and a second. Questions? Hearing none, we're ready to vote. All in favor, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Moving on to 36, you recognize.
Next request is for a competitively procured contract with Consumer Direct of Tennessee, or CDTN. We're requesting to exercise an existing renewal option year, increase the maximum liability to support that option year, as well as make some changes to the scope of the contract to account for shared savings funding approved by the legislature through the budget process. TennCare utilizes CDTN to assist with recruiting, hiring, training of consumer-directed workers for members enrolled in our LTSS programs. So we're thinking about the elderly and disabled enrollees that get served in their homes. This service also manages and monitors payments to those workers. We're requesting an increase in the maximum liability of $5 million. Of that, about $2 million is state and about $950,000 is shared savings.
You have a motion. I have a second. Any questions on this contract? Hearing none, we're ready to vote. All in favor, please say aye. Aye. All opposed, nay. Ayes have it. That contract is approved. Moving on to item number 37. You're recognized.
Next contract is for a competitively bid contract with Gainwell Technologies. We're requesting to extend 1 year and increase the maximum liability to accommodate that year. Gainwell operates our largest IT system, which is our Medicaid Management Information Systems, or MMIS. This system is essentially the brain of TennCare. We can't operate a Medicaid program without it, as all the data, provider data, claims data.
Have a motion and a second. Any questions for this contract? Senator Yarborough.
Sorry. So thank you, Mr. Chairman. So this contract, again, was originally awarded in 2009 with a sort of 9-year maximum after all extensions. And I think we're extending it to year 18.
That's correct.
Help me with that.
Yeah, so this is a contract that we have previously rebid. We had a competitive RFP, we awarded it, and then shortly, so we would be off it by now. Shortly after we awarded that, the second Trump administration came in and they changed the policy guidelines to state Medicaid agencies for what kind of systems that we had to build. There's a lot in there, but the most important and simple part of that is they essentially allowed for some flexibilities that allow states to build cheaper systems. And so our whole RFP was built under the old framework, which was a more expensive framework. And so at that point in time, we made a decision to scrap the RFP and start over under the new framework, which should save the state tens of millions of dollars. The downside is we have to extend this, another couple of years while we redo a whole nother procurement. So again, not ideal to be extending. We thought that was the right decision given the new flexibilities the federal government was offering us. So that's what we're doing.
Follow up? Any other questions? Seeing none, we're ready to vote on this contract. All in favor, please say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Item number 38, you're recognized.
Next contract request is for a competitively procured contract with McKinsey. We're requesting to amend the contract to maximum liability to account for new funding awarded through the Rural Health Transformation Program. This contract is specifically related to the creation and evaluation of value-based purchasing programs at TennCare. Part of the Rural Health Transformation Program application for Tennessee included dollars for value-based purchasing programs for maternal care in rural areas, which is an issue of struggle and need in this state. And so Department of Health is doing a lot of that. There is a piece that's coming to TennCare. We'll be doing some value-based payments for providers that do maternity care in rural areas. Part of that money is going to this contract to help design what that VBP system will look like. Associated dollars are $1.375 million. That's all federal, no state.
Did we get a motion and a second on this? We need a motion and I have a second, and now we have questions. Representative Shaw.
Thank you. You mentioned the rural area and women's health. Get a little more in depth about how this will help them, if you will. I think you went over this with me yesterday, but I just kind of like to get on record because I represent a rural area and how women can take advantage of this.
You recognize.
Thank you for your question. I think part of one of the challenges we've seen in this state over the last 5 years or last decade plus is that we have some areas of the state that you could probably characterize as a maternity desert, especially in the rural areas as you go out west of Nashville, where it's very difficult for women to find access to maternal health care when they're having a baby and they have to drive long distances. And we've seen, some of the access points shrink and disappear. And so this is a problem that I think is widely recognized. We can't solve it on our own as TennCare, but we do recognize that we're a piece of the puzzle with Department of Health and some of our other sister agencies in looking at this. So there is a desire to build a program that will invest more money in providers to create opportunities to have more access points in those rural areas. That's what the intent of this program is. And then this particular slice of the money is going to this contract to help with the design of that over the next few months.
Follow up?
Yeah, yes, sir. Just one quick follow-up. So when they apply for these services, they will just activate the whole system and it would automatically kick in to do that soon? Because I know in the rural areas, sometimes people have a hard time connecting with who do you call next, who do you see next? But I'm assuming that just being in the system would automatically give them that extra coverage we're talking about.
Thank you for your question. So I think what we're looking to do is create more access points. And then also sometimes you'll have a provider that's more in an urban area that's reaching out and establishing satellite clinics in rural areas to help establish those access points. So I think we're looking to encourage that. So to the extent that this is successful, we will see those access points pop up. And then those are just places that TennCare enrollees can go to receive those maternal care services.
Any other questions? Hearing none, we're ready to vote on this contract. All in favor, please say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Moving on to number 39. Mr. Seals, you're recognized.
Next contract we have before you is a new sole source contract with NADSP. This contract is a contract that we currently have in place. It's previously existed, but it's coming to the end of its lifespan. So we're bringing a new contract before you. And the reason we're bringing a new contract is because it is sole source. This is specifically related to our workforce developments in the long-term supports and services space, particularly those healthcare workers that I mentioned just a minute ago that are doing work in people's homes for the elderly and disabled enrollees. We've had massive workforce challenges with this worker population. And so one of the things that we did a few years ago is created with this contract a new training and certification program, 4 levels, where if those workers do that training, get those certifications, they get increasing amounts of incentive payments. We have 2 main metrics that we use to track workforce challenges in this area. One is turnover for these provider agencies, and the other is service initiation delays. We've seen both of those metrics move in a positive direction since we started this contract. We feel like it's very successful and would like to continue it. It is sole source because this is the only vendor that provides this sort of training and certification program for this particular healthcare population.
I have a motion. I have a second. Any questions for this contract? Hearing none, we're ready to vote. All in favor, please say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Number 40, Mr. Seals, you're recognized.
Next contract we have before you is a competitively procured contract with Q Blue Surveys. We're proposing to exercise an existing renewal option year in the contract and increase the maximum liability to accommodate that option year. Q Blue does quality of care surveys in nursing homes for us. The output of those surveys factors into our nursing facility reimbursement program. So if you get higher quality scores, you get higher reimbursement from TennCare. The amendment seeks to increase the maximum liability for that option year. The requested increase is $437,000. State portion is about $219,000.
Any questions? First, we need a motion.
Motion.
And the second, any questions? Senator Rose.
Thank you, Mr. Chairman. And again, Mr. Seals, I always appreciate your preparedness when you come here. I don't expect you to have the answer to this, but if you do, fine. If you don't, we'll send it somewhere else to get it later. From what they're doing, the surveys of these facilities, do we get a report on those surveys? And because I know I've gotten a phone call or two over the last year or so about someone's not happy with care. I'm sure everyone. So are those available to us? Thank you.
You're right.
Thank you for your question. Absolutely, they're available. The surveys are very detailed. They cover a variety of different topics and areas. We get the results of all those surveys, and then we score them. It's basically a 0 to 100 score, and then that factors into the system. So we've got all the data, and then if there's any issues that are identified by those surveys, we can always collaborate with our appropriate sister state agencies to address those.
Follow up?
And I should know, but I don't. So if you would just share with me later how to access that, I would appreciate it. Thank you very much. Thank you, Mr. Chairman.
Any other questions? Hearing none, we're ready to vote on this contract. All in favor, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. The one we've been looking for is item 41. You're recognized.
Our last request is a sole source contract with the Tennessee chapter for the American Academy of Pediatrics. We're requesting to exercise an option year in the contract and increase the maximum liability to cover that option year. The Tennessee chapter for American Academy of Pediatrics, or TNAP, provides education, outreach, training, and curriculum for a variety of things for our Tennessee pediatricians. One area is to focus on early childhood screening, diagnosis, and treatment, and another area is on a mental health program that was authorized.
I have a motion. I have a second. Any questions for this contract? Hearing none, we're ready to vote. All in favor, say aye. Aye. All opposed, nay. Ayes have it. Contract is approved. Thank you, Mr. Seals, as usual, very efficient and informative. And with that, I'll hand the gavel back to Chairman Gardenhire.
Thank you. 2 items. The next meeting will be Wednesday, June the 24th, 10 p.m. right here in this conference room. Second, need to turn the lights out. This party is over. I'll entertain a motion to adjourn. We're adjourned.
Turn the lights out.